Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center reporting for the week of July 24th, 2023. After a brief COVID status update, I'll review two recent articles on long and post-COVID. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. I have been getting a lot of questions and concerns that it is very difficult to tell where we are in the pandemic, and folks are asking how we can know what's going on if we don't hear anything about it on the news, and so many data sources have gone away. So just a reminder of the COVID data sources that we do still have and that we are still looking at, although I know every week I don't go over every single one of them, just by way of reminder, and each of these has limitations to them, but altogether they can give us a better picture of what's happening. And the main data sources are sequencing, wastewater, percent positivity, emergency department visits, hospitalizations, and deaths. And within each of these, there are different nuances, but I put them in this order because these are roughly in order from early indicators to later indicators. Sequencing data at this point is mainly useful to give us a sense of what's going on around the world and what might be happening next. It can give us a clue if there's something coming that can be a future problem for us. And I think there's other clues it can give us if we get a little more sophisticated with it. Right now, I think we're just concerned that sequencing is kept up and we continue to get reports and that we get them timely enough to do something about it if needed. Right now, fortunately, we continue to deal with primarily the XBB subvariants, as you can see here. And again, don't be fooled by the EG.5, which is on the rise. It's still actually in the XBB family. It's just another name for XBB.1.9.2.5. So again, in this category, no news is good news. What we're keeping an eye out for here is whether there is a new variant that comes on the scene that will get around our prior immunity or our vaccines. And remember that the vaccine that is coming out this fall will be against one of these XBB varieties. So we are hoping that those are the variants that we are continuing to see when the time comes. Next is wastewater. And one way to look at it is how this map is showing it, which is the percent change over the preceding 15 days. And unfortunately, we can see all those dark gray dots are where there is no recent data having been provided at all. But of the sites that are providing data, we can see quite a bit of red and orange dots. Actually, more than 50% here are showing increases over the last 15 days. The blue dots are in areas that are staying the same or decreasing. And wastewater, at least in theory, can be a useful indicator if we are increasing. And so this is something you might want to look at for your area for trying to get a sense of what's going on. Taking a look at test positivity, the darker green means less than 5% positivity, and the lighter green means between 5 and 10% positivity. So you can see that the whole country is under 10% positivity. Of course, between 5 and 10 is considered high. But what I wanted to show here is that this picture is looking at the last month. If we look at the past 2 weeks, then we can see that more of the country is in that 5 to 10% range. And if we look at just the past week, even more of the country is in the 5 to 10% range. So hopefully we will stay below 10% for most of the country. But as we can see, the test positivity rates are essentially increasing at this time. And as I talked about previously, test positivity is less reliable than it used to be because most tests are happening at home. However, I do still think it could be useful to look at whether it's going up or down just to get a sense of trends. And that's because even though there are relatively few people going to get tested, this testing behavior at this point is probably not likely to change dramatically unless there's some dramatic change of circumstances. So unless and until that happens, I think we can at least look at whether the test positivity is going up or down to give us a bit of an indicator of where things are going. And again, right now it does appear to be creeping up, but we'll just continue to keep an eye on that. The next indicator we can look at is emergency department visits. This graph is looking at the percentage of emergency department visits with the diagnosis of COVID-19. And you can see here that this rate has been increasing pretty steadily since mid-June, all the way through the last day we have here, which is July 21st. So throughout the past month, over the past month, we've had what is a slow increase in terms of the percentage of emergency department visits with a COVID-19 diagnosis. And we know there's no longer routine testing going on in emergency departments. So I think this indicator is actually going to become more reliable because at the point that COVID tests are being done, it's really because there's a suspicion of COVID. So if we see emergency department visits with COVID increasing, I think that probably is a good indicator that COVID is increasing. And at least this metric seems to be being reported a little more timely than some of the others. So the metrics I've covered so far, sequencing, wastewater, percent positivity, and emergency department visits are going to be somewhat of our earlier indicators. They're more leading indicators, and the next two are what we would call lagging indicators, and those are hospitalization and death. And we call those lagging because hospitalization, even though hospitalization can occur in the acute phase of COVID, like in the first week, it usually lags behind the case by a couple weeks because more of the hospitalizations are now in the later phase, which is the inflammatory phase in which folks can be pretty sick and need to be admitted to the hospital or the ICU. So this might be a couple weeks after the case, and death again is even several weeks after that typically. So taking a look at COVID hospitalizations, we can see that there has been a 10% increase in hospitalizations for the last week. The last week that we have data for, which was through July 15th. So unfortunately, that is still lagging behind almost 10 days. But the last week that we have confirmed numbers, that's a 10% increase in hospitalization. So that's significant. So we're seeing increases in wastewater in many places, increases in percent positivity in many places, increases across the board or on average of emergency department visits and hospitalizations as well. So this kind of would all point to that we are having an uptick, although how big that's going to get or how severe that is certainly will vary, I'm sure, depending on where you are, and some of this is going to be difficult to predict. But for instance, if we're having an uptick now, we wouldn't expect to see increases in deaths for maybe another month or so. The last week that we have provisional death counts for is June 24th. So several weeks ago now. So unfortunately, that data, by the time we get it, it is rather old and it's a lagging indicator, but death counts probably are the most accurate out of all of these metrics that we have in terms of being able to really say how we're doing in terms of deaths from COVID. The death certificate is a definitive legal document, and even though I'm sure that it does miss some, especially as we reported last week, the 16.5% of deaths that happen at home, it is still a fairly reliable indicator. So this is the 17th week in a row that we are having declining death numbers, but we're still over 500 deaths per week. So we're at 531 deaths for the week ending, or the week of June 24th. So there's been some ticking down since mid-February, but still over 500 deaths per week. This is still too high. Over 43,000 people in the United States have died from COVID in just 2023 alone. Now I want to review two new publications that have come out regarding post-COVID and long COVID findings. And I chose these two studies because they're fairly recent and they also have some longer term findings, which is really something that we need and have been waiting for a little bit and need a lot more of. Remember, we still have no cure for long COVID. We have very little in the way of treatments. And that is a lot because we're still just gaining an understanding of what is actually causing all of the different aspects of long COVID. And there are many different aspects of long COVID and post-COVID. This Nature article from January, I would still consider the most comprehensive and kind of definitive publication on long COVID so far. And I reviewed it in some detail in a briefing earlier this year, but it is very comprehensive and helpful. So if you're trying to get up to speed on long COVID, I would suggest checking it out.
This graphic, I think, is helpful. It's basically showing long COVID symptoms and how it can impact just about every organ in the body. So we can see here the symptoms and kind of the underlying disease that seems to be happening in these different organs of the body after COVID with people who are suffering from long COVID. So definitely, if you're looking for a comprehensive overview, I'd suggest taking a listen to the past briefing and also taking a look at this article. They are both linked in the post. This graph is showing the increased risk of a number of post-COVID kinds of events that can happen, like a clot in the lungs or a heart attack, heart failure, and so on.
This study was published earlier this year in the British medical journal Open Heart. And this was an important study because it's the most comprehensive study to date that is looking long-term, and it's using cardiac magnetic resonance, basically like an MRI of the heart, to take a look at changes in the heart. And it was looking over an entire year. And they took a look at 534 people with long COVID. They received a cardiac MRI and MRI of other organs as well, 6 months after their COVID infection. So they were looking at people who actually had long COVID. They excluded anyone that had active viral infection or symptoms. They checked out their cardiac and other organ MRIs at 6 months after COVID, and what they found is about 1 in 5 had an abnormal cardiac MR. So 102 out of the 534 people, or 19% of the individuals with long COVID, had an abnormal cardiac MR. Then what they did was to call back all those who had the abnormal cardiac MR for rescanning. So they took only real findings on the cardiac MR, anything that was benign or anything that wouldn't normally require follow-up. Those people were not invited back for follow-up. So these were significant findings on cardiac MR at 6 months post-COVID, and they called those people back again another 6 months later. And what they found was that 58% of those had ongoing abnormalities at 12 months. And in those who had ongoing cardiac MR abnormalities, 49% of those had an impairment in 2 or more organs. So we don't have a conclusion on what that means, but there's a subset of folks that have ongoing issues with the heart and then other organs as well. A couple of other things they noted were that even though women are more affected by long COVID, men had a higher risk of these cardiac abnormalities in the study. They also did a number of blood tests, including some of the different enzymes and things that we do check when people are having heart issues. And unfortunately, they found that none of those lab tests correlated with any abnormalities that they were finding on the MR. And I say unfortunately only because we're looking for markers, or we're looking for something where we can do a blood test and see what kind of indication we can get about what's going on with long COVID, but there is no correlation that they were able to find there from of the lab tests to the cardiac MR in the people that were experiencing long COVID. And the MR abnormalities that they found were mostly ventricular dysfunction. So the large chambers of the heart were either dilated, not pumping properly, again, in 1 out of 5 individuals with long COVID at 6 months. And then they persisted in over half of those people at 12 months. So unfortunately, these are structural changes in the heart. And again, we don't have a lab test that's going to detect this. Not everyone's going to have access to cardiac MR. I'm not sure if that's what's going to be indicated or needed in the future. And in this study, a significant number had the structural changes persist even after a year. So as you can see, we are just now learning some of these things. We don't have a way to predict who this is going to happen to, and we're still in the early stages of our understanding, but we are learning more every day. And next, I want to review this very recent article published just on July 21st, 2023 in The Lancet, called The Effects of COVID-19 on Cognitive Performance in a Community-Based Cohort, a COVID Symptom Study Biobank Prospective Cohort Study. And if you've been listening to me, you know that I love the biobank. This is a UK biobank with a humongous data sets where they continue to collect data over the long term. This is actually preceding COVID, but there's also a COVID symptom part of the biobank, and that is what this study was looking at. So this study ended up looking at 3,335 individuals who completed an initial round of cognitive assessments. Another 2,435 people completed a second round of cognitive assessments. And there was a group of people who within this who completed both assessments, and that was 1,768 people. And these cognitive assessments included 12 different tasks that were assessing different types of mental function, including memory, attention, motor control, and reasoning. And this is actually an online platform. The link is in the post. It's actually pretty interesting. And the same platform has been found to be sensitive in picking up cognitive impairment early in Alzheimer's disease and other forms of dementia. It's also been found to correlate with cognitive impairment after brain injury, and it has been found to correspond with MRI findings. So they evaluated the accuracy, the reaction time, and other metrics for each task and each participant. And what they found were cognitive deficits following SARS-CoV-2 infection that persisted nearly 2 years post-infection. And these cognitive deficits were worse for people who had a longer duration of their symptoms or ongoing symptoms or more severe infections. So the good news in that is that people who reported that they felt fully recovered from COVID-19 didn't have any deficits on these tasks. So that's good news, because there is definitely that concern that people may not be perceiving that they're still having issues. But what they found here is that those individuals who had 12 or more weeks of symptoms after their SARS-CoV-2 infection had detectable deficits in cognitive accuracy that unfortunately did not improve over time. Also did not worsen over time, but did not improve over time. One thing they emphasized that I thought was important was that ongoing cognitive deficits had to do with the longer duration and the ongoing symptoms. And so that's something that we should really be looking at, not just a one point in time kind of assessment. And they concluded by saying, and I quote, "Future work needs to focus on trajectories and mechanisms of recovery, ongoing symptoms following COVID-19, as well as the long-term implications on individuals and society of the persistent cognitive deficits observed in the study." So this is a good reminder that there is still a lot we don't know. We still have a lot to learn. We should certainly be humble, because there's so much that we don't understand and that we actually don't have a way to necessarily treat yet, but we are still learning. Also, remember, we're still learning about the effects of repeat infections. We're still learning about post-COVID events. We're still learning about long COVID events or long COVID. What we do know is that after COVID, we are seeing, now we just reviewed structural heart changes. We're seeing cognitive issues. We're seeing increased new onset diabetes and worsening control of existing diabetes, blood clots, heart attacks, strokes, and not in everyone, but we still cannot predict who. And we also know that if you caught COVID once and you did fine, that is not a guarantee about next time. So we're wanting to avoid reinfection, because every infection is a new opportunity and maybe even a compounded opportunity for long COVID and post-COVID impacts. So please do what you can to avoid getting infected or reinfected and avoid spreading it to others. There's still quite a bit of COVID out there. And as we've reviewed, it does seem that we're having a little bit of an uptick. So let's keep our best practices to prevent the spread of COVID-19 and prevent outbreaks. Stay up to date on vaccination And that may mean something different depending on who you are. I reviewed this in a lot of detail in last week's briefing, where a high quality filtration mask like an N95, a KN95, or a KF94, especially if you're indoors with others. Very importantly, if you are going to be indoors, you want to make sure there's good ventilation and filtration. You can, as a proxy, assess the ventilation using a CO2 monitor, but limit your time indoors, limit the amount of mixing that you're doing, and whenever possible, gather outside. If you are going to be having a gathering indoors, you may consider implementing pre-gathering testing as another layer of protection. And if you're someone who should be treated, if you catch COVID, then you should know this in advance. You should have a treatment plan. Treatment can reduce the risk of hospitalization or death by about 80% if you start on time. And we're still losing over 500 people a week to COVID. So this is still claiming lives, and we can prevent a lot of this with timely testing and treatment. And remember, getting treated in time means you have to test in time, so know where you can get tested. If you don't feel well, please stay home and rest. Don't spread what you have to others. And as always, remember to eat a balanced diet, incorporate fruits and vegetables, whole grains, avoid sugary drinks, consider a multivitamin supplement, get your blood pressure checked, get your baseline labs checked, get some regular physical activity. Unless you're sick, in that case, please get your rest, manage your stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thanks so much for joining us, and we'll see you again next Tuesday at 10 a.m.